Good morning, everyone, and thank you so much for being here on this summer-like morning here in the city of Boston, and we appreciate City hosting us here at City Hall Plaza. I'm Peter Slavin, President of Mass General Hospital, and we really want to welcome Robert Kraft, members of his family, Governor Baker, Mayor Walsh, and Attorney General Healey. We appreciate all of them being here to celebrate this great occasion. Please help me thank them for being here. Today we gather together to cut the ribbon and launch this new initiative called Care Zone. Exciting new initiative coming out of the Kraft Center at Mass General Hospital that we hope will be yet another weapon in the war against opiate addiction that so many people in this tent, in this community, are battling against so vigorously. I wanted to recognize a few people who aren't in the speaking program, but are here with us today. Wanted to recognize the Suffolk County DA, Dan Conley. Boston Police Commissioner Bill Evans. Fire Commissioner Joe Finn. Massachusetts Transit Chief Kenneth Green. Members of the Boston City Council who have joined us today. Please help me thank our city councilors. And I also wanted to recognize from the MGH two individuals. The first is Dr. Derry Stasel, who for the first 5 years of the Kraft Center was its director. Derry, thank you so much for being here. And the second is Dr. Timothy Ferris, the chair and CEO of the Mass General Physicians Organization. Tim, thank you so much for being here as well. It's now my pleasure to welcome to the podium Dr. Elsie Taveras. Elsie is not only the executive director of the Kraft Center, but is also the chief of the Division of General Academic Pediatrics at Mass General. This has been a terrific year for Elsie in a number of ways. She became the head of the Kraft Center. She became a full professor of pediatrics at Harvard Medical School. She was also received the Public Health Leadership Award from the Mass Public Health Association, and also was named one of Boston's most influential women by the women of the Harvard Club of Boston. So, Elsie, congratulations on a terrific year.
Well, thank you, Peter, and thank you all for joining us this morning for the ribbon cutting of our new program from the Kraft Center for Community Health. I'd like to tell you a little bit first about the Kraft Center and how the Care Zone program came about. The Kraft Center was established by a generous gift from Robert Kraft to expand access to high-quality care for disadvantaged populations. Robert has focused the Kraft Center's initiatives on supporting doctors and nurses committed to community health. The center has trained over 75 clinicians and has partnered with over 25 community health centers to improve care for low-income people. Building on these successful first 5 years and faced with many emerging and continued challenges to community health, Mr. Kraft challenged us to go beyond the doors of our health centers and develop boots-on-the-ground, frontline services to better meet the needs of marginalized groups. True to his character, he urged us to not shy away from some of the most challenging, urgent issues. He pressed us, and really pressed us, to more than deliver, not just deliver, on the Kraft Center's mission and improve access to care, to push existing boundaries, and to not forget people who have fallen through the cracks. Well, no issue demands leadership, action, and innovation more than the current opioid epidemic. There's a clear and visible opioid crisis, both locally and nationally, impacting people from all walks of life. Many of us have family members, friends, and neighbors who have been directly impacted by this crisis. The fundamental cause of this crisis and these deaths is the disease of addiction, and the required solution to this epidemic is to build out the continuum of care. This is a condition for which we have effective, life-saving treatments available, but many people lack access to those treatments. This gap in access to care is what we hope to fill with the Care Zone program. The program will build on the amazing work by both the city and state to address difficult-to-reach, vulnerable populations and aim to reduce overdoses and save lives. Care Zone is a mobile health program that will focus on increasing access to treatment for people with substance use disorders. The mobile unit will work in areas of Boston where data show high rates of overdoses. We will aim to not only increase access to healthcare services, but to engage individuals in recovery and connect them with long-term community-based care. The unit will be staffed with doctors from the Boston Healthcare for the Homeless program and by outreach workers from the Boston Public Health Commission's AHOPE team. Both partners bring decades of experience working on the front lines of the opioid crisis, and we are in very good hands. I'll end by saying that Care Zone is the culmination of many, many months of planning and strategizing with collaborators and partners throughout the city and state, some of which you'll hear from in a bit. We spent many months listening and engaging with local community leaders, many who are here today, thank you, who so generously gave of their time to provide us feedback, suggestions, words of encouragement, and offers of support. We are incredibly grateful to have had you all as architects in the co-creation of this program. We are grateful to Dr. Monica Burrell at the Massachusetts Department of Public Health and her team, to Dr. Sarah Wakeman and Marty Kane from the Mass General Hospital Substance Use Initiative, who have set a very high bar for creative, innovative solutions to this crisis. We're also incredibly appreciative of Josh Kraft and his encouragement to think outside the box and develop an impactful program. We are thrilled to finally get this van to the streets, and so thankful to all of you who have helped us in the process. With that, I'll turn things back over to Dr. Slavin to introduce the person who's responsible for this important work and the inspiration for our ambitious mission, Mr. Robert Kraft.
So I have the privilege of introducing somebody who needs no introduction in this community, namely Robert Kraft. I've had the privilege of knowing Bob and his family for nearly 30 years. I had the good fortune when I went to Harvard Business School, my first year being assigned a two seats from his oldest son, Jonathan Kraft, and that was a great opportunity to befriend Jonathan, but the entire family. And what I've learned about Robert over the last 30 years is that there are three things that are most important to him in his life. The third most important thing is his business. And as we all know, he is one of the most successful business people in this region. And one of his businesses, the New England Patriots, has given the people of this region incredible joy over the last 20 years, winning 5 Super Bowls, and in the not too distant future, it's 6. So so Bob is a great business leader. Second thing that I think is second most important to Bob in his life is improving the community. He and I share the Jewish faith, and I think one of the most important teachings in Judaism is this concept of tikkun olam, healing the world. That's something that Bob takes very seriously. And through his philanthropy and his family's philanthropy, they have donated literally hundreds of millions of dollars to countless charities in this region, across the country, the state of Israel. And we at Partners Healthcare and Mass General Hospital are fortunate to be beneficiaries of some of that charity, which have made the Kraft Center and this program possible. So thank you, Robert, for that. And the thing that is most important to Robert and his life is his family. And my goodness, he has an amazing family, and we're fortunate that 3 of his sons are with us today. Jonathan, the oldest, who, like I said, was an HBS classmate of mine, is the president of the Kraft Group, and we're fortunate is also a trustee at Mass General Hospital. Dan Kraft, the president of International Forest Products, and Josh Kraft, the head of the Boys and Girls Club of Boston and a trustee of our sister institution, the Brigham and Women's Hospital. So thank you, Robert, for producing such a great family as well.
Well, on behalf of Jonathan and Daniel and Josh, and myself, I want to thank you for that kind introduction that put no pressure on us. So, but thank you for the leadership you've given in the championship team here at Mass General Hospital, which really, the hospital provides such amazing care for so many people throughout the Commonwealth. I also want to thank Elsie Tavares for her commitment and tireless effort in quarterbacking this mobile van unit initiative. She truly is the Kraft Center's Tom Brady. I'd like to thank our partners in this initiative, including my good friend Bill Ford from the Ford Motor Company, who helped us procure the van, the GE Foundation, the Hearst Foundation, Partners in Health, and the Mass General Hospital, and also the Massachusetts Department of Public Health, who donated the much-needed medical kits. As has been reported, we founded the Kraft Center for Community Health in 2011 because we wanted to try to help improve the health of disadvantaged populations in the Commonwealth. And our goal was to create a model that others can emulate in communities throughout the country. And we wanted to do pilot things that were innovative and hopefully worked, and then we could scale them and help those populations that were most in need, the most marginalized in the country. And while I'm proud of what we've accomplished over the last 7 years, we recognize that there's still much needed to be done. So today, as you can see, we're expanding our community health care initiative with a mobile team charged with engaging individuals struggling with addiction and complex health issues. Bringing it to the streets the way we are, it's the first of its kind in the country. And we want to provide on-demand treatment for those who are currently marginalized and really forgotten about in our communities. While this program will seek to assist with all forms of addictions, one of the most critical is the opioid epidemic, and it was amazing to me to hear that in these modern times, we have 6 people dying in the Commonwealth every day from this problem. So it has spread to communities throughout the Commonwealth and across the country, and crosses all social, ethnic, and economic lines. The Care Zone mobile unit will bring on-demand access to people with the addictions who might otherwise be forgotten and overlooked. The Care Zone will also provide the hope of recovery to people who may feel unnoticed by our society and who are in need of access to opportunities for better health. We know that to solve our country's ongoing opioid crisis, we need innovation in our approaches more than ever. And I'm happy that the Kraft Center is requiring programs like Care Zone and other preventive programs. You know, my son Josh has been a champion of innovative programming at the Boys and Girls Clubs of Boston. And he has played a large role in ensuring that the Kraft Center exemplifies this level of innovation. 7 years ago, he talked about boots on the ground approach that really led to the development of this Care Zone. I'm very proud of him for that. So we hope that this program will serve as a model for other cities around the country and will be an ultimate solution to one of our most pressing problems. But for this program or any other program to be successful, it requires a great team to be able to tackle the problem and provide the leadership necessary. I'm convinced that the next 3 speakers will provide the necessary leadership here in the Commonwealth. So together, it's wonderful to see them here together, Governor Charlie Baker, Attorney General Maura Healey, and Mayor Marty Walsh. and it's my pleasure to hand off at this particular time to the governor who was voted #1 popular governor in the country, with good reason, Governor Charlie Baker.
Well, good morning. Let me just start, first of all, by thanking Mass General, thanking the Kraft family, thanking the Kraft Center, General GE and Hearst and the other players for your creativity, your imagination, and your investment. I just want to make 3 points. The first is, while the news associated with this terrible opioid epidemic continues to be grim, there are pockets of positivity. As most people know, here in the Commonwealth, we all worked together over the course of the past few years on a series of initiatives around prevention, education, treatment, and recovery that were designed to bend the trend on what was a 15-year rise in double digits every year in overdoses, prescriptions, and deaths here in the Commonwealth. And the good news, to the extent there's any, is in 2017, for the first time in 15 years, we saw a 10% drop in deaths, a 25% drop in prescriptions, and because of the availability of Narcan, which is something we have all worked enormously hard to make more readily available, we also saw fewer deaths as a result of overdoses. Now, within that context, in 2014, fentanyl was present in about 20% of the overdose deaths. In 2017, it was present in 80% of the opioid deaths. We have a ton of work left to do here, and much of it, especially if we want to solve this problem, is not just about prevention and education and treatment and recovery. It's about creating paths, unusual paths in many respects, to treatment and recovery for people, which brings me to point number 2. We filed a piece of legislation at the end of last year, which I'm hoping the legislature will take up early in this session, to really focus on trying to create a more robust and structured, understandable, and user-friendly for families and people dealing with addiction approach to aftercare and community-based treatment. In the long run, to truly be successful here, we are going to have to do a far better job of creating treatment pathways and an opportunity for people to recognize and understand what's available to them, what works and what doesn't, so people can access what we all think of as evidence-based treatment and so many other forms of health care. And on this one, with the help of the legislature and others, I'm sure we will make tremendous progress going forward. And the third point I want to make, and it gets to something that Mr. Kraft said, maybe 3 or 4 years ago, I was standing at a conference at Harvard Medical School talking about the opioid crisis, and somebody came up to me, a reporter, and they said, you know, the Gloucester Police Department has started this new program where if you're dealing with addiction and you just show up at the police department and say you would like to seek treatment and you bring your works with you and you turn your works in, they will help you find access to treatment. And I got asked what I thought about that. And I said, you know what? Everybody's path to treatment is different. It's unpredictable, and it's not the kind of thing you can structure and manage. And if it turns out that this ends up being the path to treatment for a number of people here in the Commonwealth, that's a great thing. And here we are 3 years later. In Boston University, I spoke at it, hosted a conference several weeks ago at which they had literally hundreds of police departments from around the country who got together here in Massachusetts to talk about best practices, lessons learned, and their own experience in providing a pathway to treatment for people who are dealing with addiction using very similar models across the rest of the country. So my final point here is this is the beginning of what could be, and I hope is, a different way of thinking about providing yet another path to treatment for people who are dealing with this terrible disease. And I get the fact that we're starting small and it's a demonstration and nobody's done it before. But that's exactly what people said about that program in Gloucester, and it's exactly what people have said about so many different approaches that seem unorthodox at the time, but turn out to be effective ways of helping people connect to treatment, get back on their feet, and stay clean for an extended period of time. And on that one, to the Kraft family, to Mass General, and to the other supporters of this, we will be there to support you and to do what we can. And thank you, Commissioner Burrell and the folks at DPH for your help on this, to make this thing a reality, because let's face it, folks, we have a long way to go on this. We don't have all the answers. And one more path to treatment for people dealing with this terrible disease is a great thing, and I'm thrilled to be here to celebrate this ribbon cutting. But mostly what I really look forward to is the good work that this care zone can do for people here in the Commonwealth of Mass. Thank you very much. It's now my great opportunity and pleasure to introduce the Attorney General of the Commonwealth of Massachusetts, who has been a real champion and an ally on dealing with this issue from the beginning, Maura Healey.
Well, thank you so much, Governor. And I want to commend the Governor, Commissioner Burrell, Secretary Sutters, members of his administration. They've made this a top priority from day one. And there's been a lot of real good things accomplished. And this is about teamwork. This is about partnership. And I want to thank the Governor and his team for all of their work. I also want to thank some other partners here in the room. And I have to start with our good friend, Robert Kraft. It is not surprising to me that he is launching once again a first-of-its-kind program, something innovative, something that hasn't been tried before, and a real aim at solving an seemingly intractable problem. That's who Robert Kraft is, and that's what his vision brings to bear. I think we, of course, think about the team, but more than that, I've seen him working with us directly on our Game Change program, where he's helping drive initiatives in public schools and around the state to combat sexual harassment, sexual assault. And he just has been such a model of corporate citizenship for all of us. To Robert and to the entire family for everything that you've given in so many ways, thank you. This is just another example. And I also got to give him credit. The Elsie Tavares trade, getting her to come on over, is really something, because she is just such a force, and this is such an exciting program that you are launching. To Peter Slavin and all of the wonderful folks at MGH, thank you for everything that you do day in and day out on behalf of so many. Thank you to Ann Klee and the folks at GE Foundation, who in coming to town have made public health a priority, and this is yet another example of that. And of course, to Marty Walsh, our terrific mayor, my mayor, I'm a resident of Boston, and his team, Commissioner Lupi and others who are working day in and day out in so many ways on this and so many other important issues. You really have been so helpful in helping us think about recovery, thinking about what we actually need to do to get at this issue, and you've been a great partner and a friend to me. You know, today to me is simple. It's about a couple of things. First of all, it's about teamwork, and you see the teamwork reflected and represented in this room. I look out at Commissioner Joe Finn. I was talking to one of your captains in Charlestown last week about their efforts to try to save 2 moms who had overdosed. I think about Dan Conley, who day in and day out is working hard with others across the state to combat the scourge of heroin and fentanyl. So many of you, I see members of the police, Chief Green, others, you know, our men and women in law enforcement have really turned increasingly to become social workers. They're right there on the front lines. City councilors thinking about innovative ways to bring programming and services to folks in our communities. It's about teamwork. And fundamentally, as with any problem, no one government, municipality, business, nonprofit is going to solve it alone. It's about everybody coming to the table in innovative ways. And so today, let's celebrate that teamwork. Let's also celebrate meeting people where they are, because fundamentally, that's what this van is all about. You know, it's about meeting people where they are. And I think about a woman who called my office a while back. Her niece was in the throes of addiction and continued to overdose. She was spending a lot of time down in the area around Melnia Cass. She had been in and out of recovery programs, in and out of court, in and out of jail. But she continued to search for and yearn for recovery. Her aunt called my office in desperation, and we worked hard to try to get her services. Sadly, though, one of the things we found is that we didn't have an adequate ways to ensure the connectivity, to keep somebody hopeful, to keep somebody connected to care, and the kind of continuum of care that will actually make them healthy once again. Now, sadly, that young woman died of an overdose. But today is about making sure that we don't see that happen again. And, you know, I think about the work that we're doing, and the governor mentioned it, making Narcan available, changing our prescription drug monitoring program. As an office, you know, we're investigating opioid manufacturers and distributors. And our good friend Chris Herron is here today. He, together with the GE Foundation, have helped launch our Project HERE program, where we're in schools across the state talking about substance use and opioid youth prevention. All this stuff is important, but today it's about meeting people where they are. And again, I just want to give great credit to Robert Kraft, the Kraft family, for their innovation, for their generosity in meeting people where they are. We weren't able to save that young woman, but I know that as a result of today's commitment and what's being set out in our streets and our communities, we are going to save lives. Thank you very much, Mr. Kraft. And now I'll bring up a person who needs no introduction, but Marty Walsh has been so many things to the city. I think most remarkably, though, is his ability to show the kind of compassion and empathy and understanding that fundamentally, that's what people need. That's what people need to see in their leaders. Marty, thank you so much for all that you've done.
Thank you, General, and thank you for your kind words and all the work that you're doing. Dr. Slavin, Mass General Hospital, thank you as well. You've been a leader in this area for a long time, and I truly appreciate you constantly thinking of ways to help the sick and suffering, so I appreciate that. Governor Baker as well, I've said it more than one time, the work that the governor has done with legislation and working with the legislature in funding and programming and strengthening the prescription monitoring program and so many other programs. Thank you for making this a top priority in your administration. The elected officials that are here, thank you, Dan Conley, for being here. Eddie Flynn, City Councilor Eddie Flynn, City Councilor Nisra Sabi George, and all the City Council as well for being strong supporters. Monica Valdez-Lupi from our Public Health Commission is here. Marty Martinez, our new Chief of Health and Human Services, is here. Jen Tracy, our Office of Recovery Services, is here. Thank you for all of your great work as well in doing this. I want to thank Jonathan for your work, because I know this is a passion of yours, and people don't always know this, but when you and I talk privately, I want to appreciate the support that you give the entire people of Boston, the Commonwealth. Danny, thank you for your support as well, for the great work you do, and all the good things that you do. Josh, thank you as well for what you do in our city and our state. 4 years ago, I had a conversation. I was with Mr. Kraft at his house, and it was just the two of us, and we were on his couch talking about, I don't know if he remembers it, he does remember this. We started talking about addiction, and we started talking about people in recovery. And from that day till today, he constantly talked about people in addiction. I want to thank the Kraft family for this van. What people don't realize in Boston and Massachusetts today is that there are mothers and daughters, mothers and fathers, sons and daughters, family members out there today that are struggling with a family member with addiction. And they have no idea what's going to happen in their life. But what this van is going to do is going to bring their loved one back to them in many cases. I want to thank you for that. This van is literally going to save lives, save families for generations to come. And I want to thank you for your commitment and for your investment here today in the city of Boston, the Commonwealth of Massachusetts. I want to thank, Chris Herron was mentioned already. I want to mention Joanne Peterson as well, and many other people in this room who have been doing incredible work for a long time with addiction, trying to help the sick and suffering alcoholic and drug addict get into programming. Chris Herron and what Chris has done with the Herron Foundation. I met Chris at the State House about 7 years ago, and we started talking about recovery. We weren't talking about what he was doing, what I was doing. We were talking about recovery and about how recovery can turn a life around and how recovery can put somebody's life on a pathway that they weren't expecting, even when they had early successes where the successes might have gone away. But those successes can come back and even multiply by 100 million. And that's what today is all about. Today is all about helping people, continuum of care in Boston, meeting people where they're at, something that's really important. If those of you that don't understand what that means on the corner. That means on Melina Cass Boulevard and Mass Ave. That means on Center Street in West Roxbury. That means on every neighborhood in the city in the Commonwealth of Massachusetts where there's people that are hurting. This is another big step in fighting the opioid crisis and the opioid epidemic, which, as you heard from the Attorney General and the Governor can talk about this, and anyone in this room can talk about this, how this crisis, as this epidemic, has stolen too many of our neighbors, our friends, and our family. What this crisis has done. It's devastating. It's a public health crisis. It calls for complex, coordinated, creative responses. And that's what we're seeing here today. And in Boston, that's what we believe, that everyone deserves the support and everyone deserves the care that they can get away from the clutches of this disease. I'm not going to stand up here and talk about what the city's done, because a lot of great people have done a lot of great things, and I want to thank you for what has been done. But this crisis is all hands on deck. It's making sure that we utilize every resource that we can. We need to continue to work on the stigma of this disease so people will seek out help and won't stay in the shadows. It's important for us. It's also important that we're creative in our outreach. This new initiative does both of that. This CARES van will help expand the reach of what we do here in the city, in the Commonwealth, where our amazing A-Hope staff, they're going to continue to reach more lives and save more people. So I want to thank all of you who have something to do with this. This pilot program is based on data, best practices, and from the recovery community, and it's had extensive community input. The Care Zones van will be a dynamic healthcare resource. It's also going to help us with a lifeline to people who are at risk, and it's going to help us find those people that are falling through the cracks. And that's what this is all about. This is about working together collectively, all of us. We are a city in a state of healing and hope. We want to make sure that our neighbors look out for each other with mercy and empathy. And we want to make sure that we have a firm belief that we are stronger when no one's left behind. I just want to end by thanking the people in this room who have done this work for so long. I think back when I started in the business of politics in 1997, when we talked about it in a small room, and there was about 7 or 8 of us in a room, along with the Halfway House collaboration. And I think about 20 years later, the crisis, I don't know if it's gotten worse, it's come out of the shadows, because the crisis was there 20 years ago. But now we have everyone's ear at the table. So the folks that started this conversation and pushed us in the legislature and pushed the state and the government a long time ago, you have friends and champions. One of those champions is the Kraft Family Foundation, the Kraft family. I want to thank you so much for this. You will save lives. Thank you.
Thank you, Mayor Walsh, Attorney General Healey, and Governor Baker. We are indeed very fortunate to have you all as leaders of our Commonwealth. I want to acknowledge and thank a number of people who are here today. Mr. Paul Grogan from the Boston Foundation, an early supporter of the Kraft Center. Jim Green, Jim Green from Homeless Services in the city, who have provided us with so many hours of assistance. Sarah Mackin from the A-Hope program. Jay Walsh from the West End. And Joshua McFadden from Dudley Square. Thank you all for the amazing number of hours that you have put in to making sure that we deliver a great program. I also want to acknowledge and thank Matt Fishman from Partners Healthcare, Joan Quinlan from VP of Community Health, and Joy Rosen from Mass General. Thank you all for supporting us in this effort. We really very, very appreciative. Large-scale problems, such as the opioid epidemic, require organized collaborative efforts to achieve collective impact. CareZone is one such collaborative effort that brings together partners from multiple sectors, and I'd like to introduce you to 3 of our partners, without whom CareZone would not have been possible. First, the GE Foundation. GE's philanthropic organization has a legacy of commitment to transforming communities and leading the way on emerging issues, such as the opioid crisis. Their early support and commitment to the CareZone initiative was essential to getting this program off the ground, and we are extremely grateful. Next, the Boston Public Health Commission. Commissioner Lupi runs the nation's oldest public health department and is a trailblazer in the field of community health. Its AHOPE program, which you've heard about, has been a trusted leader in addiction services in the city for many years, and we're so fortunate to work with the AHOPE team on CareZone's neighborhood outreach. And Boston Healthcare for the Homeless program, unparalleled in its commitment to ensuring the highest quality health care for homeless men, women, and children. We are so proud to have them as clinical partners for CareZone, where they will continue to provide their renowned care with compassion and heart. So without further ado, I'd like to introduce Ann Klee, President of the GE Foundation, Monica Valdez-Lupi, Executive Director of the Boston Public Health Commission, and Dr. Jesse Gaeta, Chief Medical Officer of Boston Healthcare for the Homeless program.
Thank you. On behalf of GE and the GE Foundation, I want to share our thanks for being here and recognize the great leadership, not only of the governor, the mayor, Bob Kraft, Attorney General Healey, the Kraft Center for Community Health, and really everybody who's here who's been recognized playing such a critical role in addressing the opiate crisis, which is, I think, our #1 public health crisis today. When GE announced that we were moving to Boston almost 2 years ago, it feels like a lifetime ago, we announced a $50 million philanthropic commitment to Boston, and this was part of it. When we came to Boston, we talked to community leaders, we talked to people in the health community, we talked to government leaders. We wanted to know where we could have an impact. And what we heard resoundingly from everyone was that the opiate crisis was the #1 problem to address. And we knew that we could play a role, we could have an impact, we could help accelerate innovation, expand access to treatment, and really importantly, help address stigma, which is one of the key factors that prevents people from getting treatment for this disease. And it is a disease. And so we went all in. And we know that partnerships are critical to solving this crisis. And so we're delighted to partner with everyone in the room today. We've partnered with the Heron Foundation and Attorney General Healey to bring education to address prevention in middle schools, with community health centers to expand access. There's no one solution, as the governor said, but we have to bring multiple solutions to the table. And it's because of that that the CareZone is so critical. This is innovation. This is bringing treatment to where people are. This is expanding care, not only primary care, which they need, but care for behavioral health issues, for addictions, and for opiate addiction particularly. We're really proud to be part of this effort. We know it's going to have an impact, and we know that opiate and substance use disorders affect every one of us. Every single one of us knows someone who's impacted by this disease. And if we can get, and we can support efforts like this to get treatment to more people, more effective treatment, it's personal. And I'll share a quick story. Last year, we did a workshop at our Lynn facility, not so far down the road from here, and we talked about substance use disorders, and we talked about programs that were available. It was the most impactful program that we've run for our employees, I would say, at that facility. We had employee after employee who raised their hands and shared their story. And one person came forward, Greg, who had never shared the story of his addiction. And he talked about how it had impacted his family life, it had broken up his marriage, and how his social network and the treatment that he got was so critical to helping him get through that period in his life. He shared that story, and it had an impact. Unfortunately, we have another story. Several months after that, we found one of our employees dead in the bathroom. He had overdosed. He didn't get the treatment that he needed. So these kinds of mobile units are going to get treatment to people that we might not otherwise touch. We're proud to be part of the effort and really recognize the leadership that the Kraft family and Mass General have brought. We look forward to continuing partnerships in the future. There's a lot more work to do, but I think the governor is right. There is positivity out there. We are making a difference, and we are going to continue to make a difference. So thank you all for your support, and we look forward to working with you.
Good morning. Thank you. We are so excited to be part of the kickoff of this exciting Kraft Center Care Zone initiative. And like our colleagues, I do want to acknowledge and thank Elsie and the Kraft Center, Dr. Slavin at MGH. Thank you to Mr. Kraft and your family, to Ann at GE, to Dr. Gata, and our colleagues at Healthcare for the Homeless, to the governor and the attorney general, and our quarterback and captain at the city, Mayor Marty Walsh. On our team at the city, this work would not be possible with so many of our partners, and so I want to say a special thank you to Commissioners Evan and Commissioner Finn for all the work that you do and the way that you collaborate with us and make our team in public health stronger. To Jen Tracy, who's our director for the Mayor's Office of Recovery Services. And a special thank you as well to, you've heard Sarah Mackin, who leads our AHO program, and our newest member of our team, Chief Marty Martinez. We know in the room that addiction is a disease that is too often framed as a moral failure, and every day those struggling with opioid addiction must also cope with the ever-present stigma that they're tackling around getting care and preventing them oftentimes from seeking the care that they need. As the largest and most comprehensive harm reduction center in New England, our AHO program provides high quality and also compassionate drop-in care and services. Through our own experience, it has always been clear that in order to effectively address this crisis, we must address it and approach it with compassion. While we have, and I feel really lucky to be in a city and a state where we have an extensive network of recovery services spanning the continuum of care, there are certainly people who slip between the cracks and who are uncomfortable with traditional healthcare services. And so the van behind us today and all the special people who will be in the van providing those services are going to address the people who are slipping and who are having a difficult time navigating the resources that we have available. In partnering with the Care Zone team, the Health Department and our AHOPE team are so excited to be able to help expand the reach of these services and bring those services to those that need it the most. Being able to mobilize our services will allow the Care Zone team to respond in near real time to emerging needs in our communities. We're all touched, and you've heard, by this epidemic, and the urgency of this crisis can't be overstated. So that's why we're so excited at the Commission to be part of such innovative programming like the Care Zone. We're so proud to be part of it. We're eager to learn and help individuals during this important pilot phase. So thank you very much.
Good morning. I'm so thrilled to be with you here today to launch this project, and I'd like to express immeasurable gratitude of Boston Healthcare for the Homeless program and our patients for the thoughtfulness, the collaborative spirit, and the investment that has gone into making this initiative a reality. At no other time in recent history have we so needed the ability to come together to develop innovative and flexible solutions to a crisis of this magnitude. We're deeply grateful to the Kraft Center for Community Health, to the Kraft family, to the Massachusetts General Hospital, the GE Foundation, the Hearst Foundation, the City of Boston and its remarkable Boston Public Health Commission and AHOPE, and to the state of Massachusetts for partnering on this endeavor. By the time today comes to a close, ambulances across our state will have rushed to yet another 50 or so new opioid overdoses. And of these, a handful of people, maybe 6 today, will be lost to us forever. The rest we know will be at high risk for a second overdose in the days to come. In the groundbreaking Chapter 55 analysis undertaken by the Department of Public Health, we've seen that the medications buprenorphine and methadone cut the overdose risk in half for people who have already overdosed once. Despite the stigma still surrounding these treatments, no other intervention has been shown to be as effective. Yet we also know that people face wait lists for such treatment, and that this waiting period has been proven to put them at greater yet risk of overdose. The aim of this van is to cut those waiting periods out of the equation, to remove every last barrier to getting help, and to bring state-of-the-art care directly to people who need it, where and when they need it. I can't tell you how many times I'm walking down Massachusetts Avenue and someone sees me on the street and says, "Hey, doc, I remember you, and I think I want to get some help today. Can we talk about it?" And I know in that moment, if I can't drop everything and mobilize right then, that this person likely won't make it through the waiting rooms, the lines, the logistics, the withdrawal on her own. The very nature of addiction for some people makes this kind of follow-through nearly impossible. And so for many, especially the patients that I see on a daily basis, their heartbreaking histories of trauma and loss cause them to relentlessly avoid traditional brick-and-mortar medical settings. By delivering services to people right where they are, we want to make it clear, no matter where you're at, you have worth. You don't need to stop using before we can start helping you. Where you see struggle, we see resilience. Thank you again for all of your support in making this message of hope and this creative project a reality.
Thank you all very much for your ongoing commitment to this program. As you can tell, and as I said, we are in very good hands, and we're fortunate to be able to partner with you all. I want to end by thanking the Ford Motor Company for their donation of the van. Mr. Bill Ford, who donated the van to us, said, "We had him at hello," which is wonderful, and we hope to hear that from many others who want to imitate our program in the months and years to come. The Winnebago Company, for their terrific work to build a medical unit. I hope you all will be able to come up and take a look at the amazing and beautiful clinical space inside. And of course, to Partners Healthcare, to the Massachusetts Department of Public Health, and to Dr. Slavin for his leadership for making the opioid epidemic a leading priority for our hospital. As you can see, the Care Zone program is the culmination of the hard work and support from a remarkable team of partners, supporters, and community members. And now I would like to take the opportunity to invite our speakers to make the launch of Care Zone official with a ribbon cutting.